A 64-year-old patient sat across from me last year and said something I will never forget. He looked down at his hands, cleared his throat, and said, "Dr. Amanda, I've been avoiding my wife for 6 months, not because I don't love her, because I'm terrified of what's going to happen, or not happen, when I'm with her." He wasn't sick. His heart was healthy. His blood work was fine. But erectile dysfunction had quietly dismantled his confidence, his intimacy, and his sense of who he was as a man. And the saddest part? He had no idea that what he needed wasn't a pill. It was a practice. A set of specific, targeted exercises that could have been restoring his function for months, for free, at home, in private. Today, I am going to give you exactly that. The best exercises, clinically validated, urologist recommended, to stop erectile dysfunction in its tracks and restore the penile health you thought was behind you. I'm Dr. Amanda Brooks, a board-certified urologist with over 12 years of experience helping men over 60 reclaim their vitality, strength, and confidence. I've worked with thousands of men who came to me convinced their best days were behind them. Men who had tried medication and didn't like the side effects. Men who were too proud to ask for help until the problem had cost them years of intimacy and self-worth. And over again, I've seen what the right physical practice, the right exercises, done consistently, can do for a man's body and his life. Before we dive in, please hit that like button right now and drop a comment telling me where you're watching from. I genuinely love connecting with men from all over the world who are taking their health seriously enough to be here. Your engagement also helps other men find this video, and some of them desperately need it. Now, I want you to understand something important before we get into the exercises. I want you to understand what is actually happening inside your body, because when you understand the mechanism, the exercises make complete sense, and you will actually do them. Here is the first problem. Erectile dysfunction is, at its core, a circulation problem. A strong erection requires a rapid and significant increase in blood flow to the penile tissue, specifically to two cylindrical chambers called the corpora cavernosa. When blood rushes in faster than it drains out, the tissue fills, expands, and firms. But after 50, blood vessel walls stiffen. Nitric oxide production, the chemical messenger that signals blood vessels to dilate and open, drops by nearly 75%, compared to your levels at 30. The result is slower, weaker blood flow, less filling, less firmness, a body that no longer responds the way it once did. Here is the second problem. The muscles that support erectile function weaken with age, and almost no one talks about this. There is a group of muscles at the base of the pelvis called the pelvic floor muscles, specifically the bulbocavernosus and ischiocavernosus muscles. These muscles play a critical, active role in erection quality. They compress the veins that drain blood from the penis during an erection, effectively locking blood in and maintaining rigidity. When these muscles are weak, and in men over 50, they are almost universally undertrained, erections become softer and shorter lasting, not because of hormone problems, but because the physical mechanism holding the erection in place has lost its strength. Think of it like trying to hold water in a leaky bucket. No matter how much you pour in, if the bottom is weak, it drains. Here is the third problem, the psychological dimension that becomes its own physiological problem. Performance anxiety triggers the release of adrenaline and cortisol, both of which are vasoconstrictors. They physically tighten blood vessels and restrict the blood flow required for an erection. So a man who has one disappointing experience begins to dread the next one. That dread releases stress hormones. Those stress hormones make the next experience worse, which increases the dread. It is a cruel and self-reinforcing cycle, and it is entirely breakable, but only if you address the physical foundation first. When your body is physically capable, the psychological fear dissolves on its own. Today, I am going to walk you through 7 exercises, a complete protocol, that target every one of these mechanisms. Stay with me through exercise number 5, because it is the one most men have never heard of, and it may produce faster results than anything else on this list. Exercise 1. Kegel contractions for the pelvic floor. Biologically, Kegel exercises directly strengthen the bulbocavernosus and ischiocavernosus muscles, the muscles responsible for compressing venous outflow during an erection and for the rhythmic contractions during orgasm. A landmark study published in the British Journal of Urology International found that pelvic floor exercises resolved erectile dysfunction completely in 40% of men and significantly improved it in another 35%, outperforming medication in long-term outcomes. These are not minor results. These are life-changing results from an exercise that costs nothing and takes 3 minutes a day. The mechanism is simple. A stronger pelvic floor means blood is locked into the penile chambers more effectively, maintaining rigidity longer. Emotionally, I want men to understand that weakness in the pelvic floor is not a character flaw or a sign of age-related inevitability. It is a training deficit, nothing more. Every other muscle in your body weakens when it isn't trained. This one is no different, and like every other muscle, it responds to training. Men who commit to Kegel exercises consistently for 6 to 12 weeks describe a return of erection quality that feels almost miraculous. But it isn't miraculous. It is simply physiology responding to stimulus. Practically, here is exactly how to do them. Find your pelvic floor muscles by imagining you are trying to stop the flow of urine midstream. The muscles you feel contracting, that upward-inward squeeze, are the muscles you are targeting. Contract them firmly, hold for 3 seconds, then release completely for 3 seconds. That is 1 repetition. Do 3 sets of 10 repetitions daily. Morning is ideal. Do them before you get out of bed. Within 2 to 4 weeks, you will feel those muscles becoming distinctly stronger. By week 8, most men notice a meaningful change in erection quality. Exercise 2, reverse Kegels. Biologically, while standard Kegels train the pelvic floor to contract and hold, reverse Kegels train it to relax fully and on command. This matters because achieving an erection requires the pelvic floor to relax first, allowing blood to rush in, before contracting to maintain it. Men who have chronic pelvic tension, which is extraordinarily common in men over 50 who carry stress in their lower body, have a pelvic floor that is chronically semi-contracted. This restricts initial blood inflow and actually inhibits the very erections they are trying to achieve. Training the relaxation phase is as important as training the contraction phase. Emotionally, chronic pelvic tension is frequently connected to chronic psychological stress. Men who work high-pressure jobs, who have been through difficult life events, who carry anxiety habitually, they carry it physically in the pelvic floor. Learning to consciously release this tension is not just good for erections. Men report feeling less anxious, less physically tight, and more at ease in their bodies overall. It is a practice with benefits that extend far beyond sexual function. Practically, to perform a reverse Kegel, take a slow, deep breath in through your nose, and as you exhale, consciously push down and outward with your pelvic floor, as if you are gently trying to push something out rather than hold something in. Hold that gentle release for 5 seconds, then return to neutral. Do not strain or bear down forcefully. This should feel like a release, not an effort. Do 10 repetitions daily, ideally pairing them with your standard Kegel sets. Contract, hold, release, push out, hold, return. This alternating practice trains the full functional range of the pelvic floor. I remember David, 66, a retired attorney who came to me frustrated and frankly a little angry. He had been doing standard Kegel exercises religiously for 8 weeks with minimal improvement. When I assessed him, I discovered his pelvic floor was chronically hypertonic, meaning permanently overcontracted. Standard Kegels were strengthening a muscle that was already too tight. I introduced reverse Kegels alongside his standard protocol. 3 weeks later, he called my office. He said, "I don't understand what changed, but something changed. Everything is working differently, better." That is the reverse Kegel effect. Exercise 3, hip flexor stretching. Biologically, tight hip flexors, the muscles that connect your lower spine to your upper thigh, directly compress the blood vessels and nerves that supply the pelvic region. After 50, and especially in men who sit for extended periods, hip flexors become chronically shortened and tight. This compression reduces blood flow to the entire pelvic region, including the penile vasculature, contributing directly to erectile dysfunction. Releasing hip flexor tension is like uncrimping a garden hose. Blood that has been restricted begins to flow freely again. Emotionally, most men have never been told that sitting is killing their erections. They exercise, they eat reasonably, they take their supplements, but they spend 8 to 10 hours a day sitting, and nobody has connected those dots for them. When they learn that something as accessible as a daily stretching routine is directly improving circulation to their most sensitive anatomy, it is both validating and immediately motivating. Practically, perform a kneeling hip flexor lunge daily. Kneel on your right knee with your left foot forward, left knee at 90 degrees. Push your hips gently forward until you feel a deep stretch in the front of your right hip. Hold for 30 seconds. Switch sides. Do this twice per day, once in the morning and once in the evening. Pair it with a standing figure 4 stretch for the piriformis muscle, which also affects pelvic circulation. 10 minutes of targeted stretching per day, consistently, over 4 to 6 weeks will produce a noticeable change in pelvic blood flow. Quick pause before we continue. If you are finding this valuable, please share it right now with one man in your life who needs to hear it. You might be the reason he gets his life back. Exercise 4, aerobic conditioning. Biologically, erectile dysfunction is now recognized by cardiologists as an early warning sign of cardiovascular disease, often appearing 3 to 5 years before a cardiac event. This is because the blood vessels supplying the penis are smaller in diameter than coronary arteries, so vascular damage shows up there first. Aerobic exercise, walking, cycling, swimming, directly improves endothelial function, the health of the inner lining of blood vessels, and stimulates nitric oxide production throughout the vascular system. A meta-analysis published in the Journal of Sexual Medicine concluded that 40 minutes of moderate-intensity aerobic exercise 4 times per week produced clinically significant improvements in erectile function in men with cardiovascular risk factors. Emotionally, for men who have been sedentary, and many of my patients have been, often due to joint pain, fatigue, or simple habit, this can feel overwhelming. I want to say this clearly. You do not need to run a marathon. You do not need a gym membership. A consistent 30-minute walk every single day will begin improving your vascular function within 2 weeks. The barrier is smaller than you think. The return is larger than you can imagine. Practically, start where you are. If you currently do nothing, begin with a 20-minute walk every day for 2 weeks, then extend to 30 minutes. If you already walk, add 1 day per week of slightly elevated intensity. Walk faster, find a moderate incline, or try a stationary bike. The target is to get your heart rate into a zone where you can speak in short sentences but cannot comfortably hold a long conversation. That is the zone where nitric oxide production is maximized and vascular repair happens most effectively. Exercise 5, penile stretching and manual therapy. Biologically, this is the one most men have never been told about by a doctor, and I want to address it with the clinical directness it deserves. The penile tissue, specifically the tunica albuginea, the fibrous sheath surrounding the erectile chambers, can develop microfibrosis with age, particularly in men with a history of vascular damage or Peyronie's disease. This fibrosis reduces the elasticity of the tissue, limiting the capacity of the chambers to fill fully and expand. Gentle, consistent manual stretching has been shown in clinical research to improve tissue elasticity, reduce scar-related restriction, and in cases of mild curvature, decrease the degree of deformity. Think of it as physical therapy for tissue that has gradually stiffened over years. Emotionally, I know this is a topic many men feel deeply private about. I want to be clear. Discussing penile health with clinical openness is not something to feel embarrassed about. It is exactly the kind of conversation I have every single day in my practice. Your sexual anatomy is anatomy. It responds to physical therapy just like your shoulder or your knee. Men who engage with this practice report not just physical improvement, but a restoration of their relationship with their own body, a sense of agency and familiarity that many had lost. Practically, in a warm state, gently grip the shaft near the base with one hand and stretch outward. Not aggressively, but with firm, consistent tension, holding for 30 seconds. Do not apply force. This should feel like a mild stretch, nothing more. Rotate through 4 directions: straight out, slightly upward, slightly left, slightly right, completing the full set in under 5 minutes. Do this once daily, ideally after a warm shower when tissue is most pliable. If you experience any pain, stop immediately. Done correctly, this practice supports tissue health and elasticity. Give it 8 to 12 weeks of daily consistency. Exercise 6, diaphragmatic breathing. Biologically, diaphragmatic, or belly, breathing activates the parasympathetic nervous system, which is the branch of the nervous system responsible for rest, digestion, and sexual arousal. Erections are a parasympathetic function. They cannot occur when the sympathetic nervous system, the fight or flight branch, is dominant. In men with performance anxiety, the sympathetic system takes over the moment intimacy begins, releasing adrenaline, constricting blood vessels, and shutting down the very physiological processes that erections depend on. Training the diaphragmatic breath trains the body to shift into parasympathetic dominance on command. Emotionally, this exercise is the bridge between the physical and the psychological. It is the practice that tells your nervous system, you are safe, you can relax, what you need is available. Men who practice diaphragmatic breathing daily, outside of any intimate context, develop a reflex for calm that carries into the bedroom without conscious effort. The anxiety that once triggered failure begins to lose its power. Practically, lie on your back with one hand on your chest and one on your abdomen. Breathe in slowly through your nose for 4 counts, allowing your belly to rise while your chest stays relatively still. Hold for 2 counts. Exhale through your mouth for 6 counts, letting your belly fall. That is 1 breath. Do 10 of these every morning. It takes 3 minutes. Over 6 weeks, this practice recalibrates your autonomic nervous system response and creates a powerful foundation for everything else on this list to work more effectively. I remember Michael, 71, who came to me after 3 years of complete avoidance. His wife had stopped initiating. He had stopped trying. He described his marriage as 2 people living politely in the same house. His vascular health was moderate, not perfect, but workable. The real issue was a nervous system locked in permanent anticipatory anxiety. I gave him the full exercise protocol, but I told him to start with the breathing practice for 2 weeks before anything else. 2 weeks later, he came back and said, "I don't know how to explain it, but I feel different in my body, calmer, more like myself." 6 weeks after that, full function restored. He and his wife are traveling together again. That's what nervous system regulation can do. Exercise 7, resistance training for testosterone. Biologically, compound resistance exercises, squats, deadlifts, lunges, and hip thrusts trigger the release of testosterone and human growth hormone, both of which directly support erectile function. Testosterone receptors in the penile tissue regulate nitric oxide synthesis, meaning higher testosterone means more nitric oxide means better blood flow. A study in the Journal of Clinical Endocrinology and Metabolism confirmed that men who engaged in regular resistance training showed significantly higher free testosterone levels compared to sedentary controls of the same age. You do not need to become a powerlifter. 2 sessions of moderate resistance training per week, targeting the lower body and core, will produce meaningful hormonal benefits. Emotionally, there is something deeply restorative about physical strength. Men who begin resistance training after years of inactivity describe a return of presence and confidence that permeates every area of their life, not just their sexual function. Feeling physically capable, feeling strong in your body, changes how you carry yourself, and how you carry yourself changes how you feel about yourself. It is a positive cycle, and it begins with picking up something heavy twice a week. Practically, if you have no experience with resistance training, start with bodyweight exercises: squats, lunges, glute bridges, and wall push-ups. Do 3 sets of 10 repetitions of each, twice per week. If you have access to a gym or resistance bands, add load progressively over time. Focus on hip-dominant movements: squats, hip thrusts, Romanian deadlifts, as these recruit the muscle groups most directly connected to pelvic blood flow and testosterone response. Within 4 to 6 weeks, you will feel the difference. Here is your simple action plan. Step 1. Every morning before you get out of bed, do 3 sets of 10 Kegel contractions and 10 reverse Kegels. This takes 3 minutes and begins rebuilding your pelvic floor from day 1. Step 2. Every evening after your shower, perform 5 minutes of penile stretching, followed by 10 diaphragmatic breaths. This combination supports tissue health and resets your nervous system for rest. Step 3. 5 days per week, walk for 30 minutes at a pace that elevates your heart rate moderately. Twice a week, replace one walk with a lower body resistance training session. That is the complete protocol. 7 exercises, 3 daily habits. Give it 8 weeks of honest, consistent effort, and your body will show you what it is still capable of. I want to say something directly to you before we finish. If you have been frustrated, embarrassed, or quietly ashamed about your sexual health, if you have been avoiding your partner, avoiding intimacy, avoiding even thinking about this because it hurts too much, you are not broken. What you have is a body that has not been given the right training. That is all. The same way a man who hasn't run in 10 years cannot run a mile without preparation, a man whose pelvic floor has never been trained and whose vascular system has been neglected will struggle in the bedroom. This is not a verdict on who you are. It is simply a description of where you've been and where you can go from here. You are capable of more than you currently believe. I have seen it hundreds of times. Men in their 60s, 70s, and 80s who did the work and reclaimed something they thought was permanently gone. Not with drugs, not with surgery, with consistency and the right exercises. It is never too late to begin. Your body is listening. Give it something worth responding to. If this video gave you clarity, gave you hope, or gave you a plan, please give it a like so other men can find it. There are men out there right now in the same silence that you may have been in, and they need this information. Leave a comment below and tell me, which exercise are you starting with today? I read every single one. Share this with a man in your life who needs it. You might not know who that is, but send it anyway. Someone in your circle needs this conversation. And subscribe for weekly, science-backed health strategies designed specifically for men over 50. What's coming next week is something you will not want to miss. I'm Dr. Amanda Brooks, reminding you that after 50, vitality isn't lost. It's simply waiting for you to awaken it. Take care of yourself, and I'll see you in the next one.